We're going to be talking about treatment options for interstitial lung disease and idiopathic pulmonary fibrosis. If patients have interstitial lung disease other than IPF, and if the interstitial lung disease is characterized by any element of inflammation, then the treatment options usually include steroid therapy given with other immunosuppressive agents. Some of them that have been used include mycophenolate, cyclophosphamide, and azathioprine. Other ones that have more historical interest with no data to support their use are colchicine, penicillamine, cyclosporin, and tacrolimus, as well as methotrexate. But typically, if patients have interstitial lung disease, we'll treat them with a combination of mycophenolate usually and steroids. We have to follow these patients closely, engage them for clinical response or stability, and decisions have to be made in terms of the utility of continuing these therapies and for how long we should continue these therapies on a case-by-case basis. Unfortunately, we don't have many or any randomized controlled clinical trials to guide us in the treatment of patients with various forms of interstitial lung disease. There are some studies in CTD-ILD, specifically scleroderma, attesting to the utility of both cyclophosphamide and more recently mycophenolate, but whether or not the benefits of these medications are sustained beyond 1 or 2 years is uncertain. And that's why one has to look at each patient individually and decide whether or not to continue therapy based on the benefit versus the safety and side effect profile of each of these medications.